My name is Sonia Santee. I am the Facilities and Programs Manager here at the Pinnacle Senior and Aquatic Fitness Center. Today we have Dr. Jacquelyn Johnson-Minter with us, and Dr. Jacquelyn Minter is the Director for Health and Human Services Department. She also serves as Fort Bend County's Health Authority. Dr. Minter came to Fort Bend County just a little over a year ago, and within a few weeks, she had to announce that the very first case of the coronavirus, aka COVID-19, happened right here in Fort Bend County, as well as the state of Texas. Since that time, Dr. Minter and her staff have worked around the clock to make sure that the citizens of Fort Bend County were able to navigate the testing process, and now they are ready to help us through the vaccination process. Dr. Minter, would you like to say hello to our audience today and tell them a little bit about who you are and what you do?
Yes, thank you so much. I am so happy to be here. Thank you for inviting me. Your Pinnacle Senior Center is one of the jewels of our county, and we love that we can serve our seniors in this way. Certainly, we have been working tirelessly, but we know it's been very difficult for the community as well.
Yes.
Pandemic is sometimes frightening, it's always uncertain, and so we do our best to address the needs that citizens of Fort Bend County have. And we appreciate your patience, and we thank you for this opportunity to just inform people a little bit more about the vaccination process.
And you are welcome. And we are happy to have you here to facilitate our Q&A virtual town hall meeting. And I just want our patrons to know that you're going to navigate us through several or a range of questions regarding the COVID vaccine. And thank you also to the patrons who submitted. You took time out of your schedules to submit questions for the Q&A. We thank you. We thank you very much. And before we begin, I would like to say that we here at the Pinnacle, and on behalf of myself, Freeman, Angie, Keith, Crystal, and Phyllis, we miss you guys so much. And we cannot wait until we see your happy faces back here when we assume programming at the center. So, and with that, Dr. Minter, if you could, let's just get right into the topic. We're happy about the fact that Fort Bend County has a vaccine available now. We've all been waiting. We've been staying at home, wearing our mask, doing all that we're supposed to do to make sure that we stay safe. And we're so excited about the fact that we do have a vaccine now. And what we have on our mind today is, how do we go about pre-registering? What are the basic protocols? What are the logistics behind how we go and get the vaccine? So if you could expand on that just a little bit before we get started, we really would appreciate it.
Sure. And I'm so happy to answer any questions. And thank you for giving me an opportunity to give a little bit of background and a little bit of overview. I always think that helps to set the stage for the questions that are asked. And then if there are additional questions, then people can think of those throughout this time. All right. So what I really want to explain is that these vaccines, I know, have been long awaited, but we've also been a little bit nervous about the vaccines. One of the reasons for this is because of the whole process. And unfortunately, it was mixed in with a political situation that made people very uncomfortable. Whatever side you're on, it doesn't really matter. It just added to some confusion. And so when we've got a wonderful product ready to go, it does cause people to want to hesitate and wonder, can they really trust that? So I think one of the things that we do best is to give people information about the process. I will say, Operation Warp Speed, it's kind of a name that makes you feel like people decided fast was better than safe. And we can't blame anyone for thinking that way. Certainly, those in the medical community were concerned as well. I can tell you I was one of those people, myself and along with some of my colleagues. So we took the time, starting in about July, to make sure we did the research. We followed the research. We had meetings with those who were doing the research, the researchers, not the companies, right? So that makes a big difference. And people that we've trusted in the past that have vetted or looked over research for past vaccines that we're taking and that we know they're safe. So we looked for trusted sources, and then we did our homework. I was probably on calls every Sunday and Thursday learning more and more about the vaccine, and I became very comfortable with the process. Warp speed, I like to try to tell people, is that it is, if you think about a package you might want to give to your grandchild, you shop for this package, you love this package, you want this package, and you want to send it for their birthday. Well, if you mail it, you can mail it two different ways. You can mail it bulk rate, or lots of different ways, but you can mail it bulk rate, or you can mail it FedEx overnight. There's going to be a different price to get it there faster.
Absolutely.
And analogy I like to give with warp speed, same good product, but putting a lot of money behind getting it produced and out there. And so I hope that people can kind of understand that difference and understand that it can be safe. Now, the way it's coming out to everyone is a little bit different. There's a lot of warp speed to get it developed, but the distribution plan was developed at the federal level to be different than it has been in the past. So they determined that the federal government would send it out directly to providers, and the local government is just like any other provider. So your Kelsey-Seybold and your two UT physicians or your other private doctor will get it all. We all get it the same way. That does present some difficulties for us just because it's new. And so we ask people to be patient as this rollout is a little bit different. We're excited that Fort Bend County has just been named a hub. We will be getting more vaccine for everyone in the population. And I can honestly say, as disappointing as it is that there's not enough for everyone, we are thrilled that people want this vaccine. This is the way to get out of the pandemic, to get to be around people you like, to be at the Pinnacle again, to share with people to get this vaccine. And especially for our seniors who are in the age range that they can have more serious side effects and more serious consequences. I have taken my vaccine as a healthcare provider who sees patients. I rolled up my sleeve right away, and I do that because it's very important. I should not be telling someone to do something I would not do myself.
Exactly.
My father was signed up in a different state and immediately got his vaccine. He's 86 and has done beautifully with his vaccine. So I do want you to know that do your homework, make sure you research, and ask people that you feel comfortable and that you trust, your physician, a healthcare provider, a nurse in your family. Please stay away from sensational stories. Please stay away from things that are on maybe on social media or maybe a once an occurrence, and try to use balanced media and people you trust. Do your homework, and then once you know that it's safe, roll up your sleeves and be ready to take that vaccine that can protect you from the severe consequences.
Awesome. Dr. Mentor, thank you so much. Thank you for your expertise. Thank you for your time. We know that you guys have been working around the clock, and we just really want you guys to know that we appreciate what you're doing for us, because this just came out of nowhere and it hit everybody unexpectedly, and we all had to readjust to our new normal, as everyone put it. And so with that, let's jump right into the questions. That's why we're here today. The first questions are going to, and as I refer to my notes here, the first questions are going to be around efficacy, risk, and side effects of the vaccine. So our first question is, after 2 doses administered of either Moderna or Pfizer, which of the 2 vaccines reduces the risk of contracting COVID-19 in the future?
So both of them do. Well, okay, so both of them protect the same way. They both are able to decrease disease, and they're able to decrease death by 95%. So that's what the research has shown us, 94.1 to 95%. So they're both equally effective. It's a new vaccine technology. By saying new, that doesn't mean it happened overnight or in the past year. It's been in research for well over a decade. But it is a new technology. And so with that new technology, we're able to get a very, very effective vaccine. Now, we're still learning about the ability for it to transmit and possibly have other infections. But what we know is that those future infections won't cause the disease and the death. So that's why we feel very comfortable with those 2 vaccines.
Awesome. So basically, what I hear you saying is that both of them are pretty much effective and
Yes.
they're going to do the job that needs to get done. So our next question comes from a patron who wants to know, after I get my vaccine, how long should I keep wearing the mask?
Such an important question. We all want to know that. We're getting used to them, but we're also getting tired. What I will tell you is you're going to need to wear your mask until, and I'm going to wear mine for sure,
Absolutely.
until most of us have been vaccinated. One, we don't know if someone's been vaccinated or not. We don't know how much disease is out there. There is still going to be a risk, and there will be time taken before enough people are vaccinated that we can feel protected taking off our masks. So we want to be really careful and we want to keep our masks on.
Awesome. Thank you so much. Another patron sent in, can you still get COVID-19 after receiving the first shot? And this is a multi question. Does the vaccine only build up the antibodies you already have in your body?
Okay, so
That's a
an
two-part
antibody response to the vaccine will start after the first dose. The second dose, and any of you all that either can remember or remember taking your kids, or you just remember about having booster vaccines. So
Yes.
that is what it does after the second. What we know is that when we get that booster, that protection is going to be much longer. So the last thing we would want to do is have a vaccine that starts working and then stops, and then we still get the infection later and may have some consequences. So the research has shown us that we need two to get long-lasting or longer-lasting protection.
Okay, so this is another question that's coming up, and we've heard some agencies and we've even heard some national news about where some agencies want to go ahead and just administer all of their first doses and then wait on the second dose. And I guess the regular person would kind of want to say, are we hoping and wishing and praying that the second dose get in, in a fair amount of time? Within the set time that you need to have it. So that question is, what are the risks if after receiving the first dose, we are unable to take the second one, or there aren't enough vaccines left to give a second dose?
So that is a very valid question. With all of the differences in the way things are rolling out, there's certainly concerns about that. At the local level, we've asked those questions. We've been on many calls about that because we don't want to start a process that is not going to be completed. What I will say, as I said before, there's going to be some protection after the first dose. It's going to be not as long lasting because you haven't gotten your booster. What we have been assured, and I was just on two calls this morning, one at 7:30 and one at 11, we have been assured that there is enough production ramping up. There was not the stockpile that we assumed was there.
Yes.
But that they are able to manufacture for that second dose. So the other thing is that there's a grace period around the second dose. So research has shown that you can get it up to 4 days earlier than you're scheduled and up to 4 days after. So you've got 8 days around the time you were supposed to get it. For maximum, you'll still get that 94.1 to 95% efficacy if you get it in those 8 days. After that, you are going to lose some, but you won't lose much. So if you get it on day 10, you'll still be very much boosted and very much protected. For those who may have already had coronavirus and suffered from it, when they get theirs, it will be an additional boost for them. So we want to make sure that people know, yes, that second dose can be given, and obviously it's new, so we'll find out how long we can go out, but certainly it's going to protect you even if it's a week or so after.
A lot of the questions are kind of running into each other, but I'm going to go ahead and ask this one in addition. But it says, can you still get COVID-19 after receiving the first shot? And does the vaccine only build up the antibodies you already have in your body? Did we already answer that question?
I think we did. Yeah, that one.
Okay, well, let's move on. Let's move on. They can rewind and go back and rewatch. Okay, so how concerning is the second dose? Will the dose trigger flu-like symptoms? There is a range of side effects from the vaccines. And if you could go ahead and expand on that.
Yes, there absolutely is. There's a range from 0 to people that have those flu-like symptoms for about 24 hours. And that's the key. So in that range of symptoms, what would be a normal adverse effect, people call it, is your body saying, uh-oh, I recognize that this doesn't belong here. So when I see it again, I'm really going to fight and protect this body, okay? And so that's why after the second dose, people are seeing more of those adverse events. Those are flu-like symptoms. They may be mild, there may be some fatigue, there's generally going to be some soreness at the vaccine site, there may be some body aches, there may be even some fever and headache, but it should not last more than 24 hours. And what we've talked to people about, even those that have felt like they had a full-blown flu, they've said, but it was gone like right in 24 hours, the difference. Now, if you have a cough with that, then that would not be a normal adverse reaction. You would want to call your healthcare provider because that should not come from a vaccine. That actually may be, if you were exposed to COVID, it could be that, and it just, started before you got the vaccine at the same, around those same times. Or it could be that you have another virus. There are plenty of other viruses that we could get.
Mm-hmm. Okay, this was one that a lot of people called in, and we had multiple responses for it. What are the side effects of the vaccine?
Right. So absolutely. And that's a really good question because people want to know, how am I going to feel afterwards? So anybody that has gotten their flu shot every year, I've interviewed a lot of people when they came into our first clinic, you can't feel it. You really can't feel it. To me, it was less than a, flu shot, but the pain in the arm, the majority of people are going to feel that afterwards. Just people are going to feel something. I've had plenty of people say they didn't, but if you've got a side effect, arm pain is going to be one. Is it arm pain that's going to keep you from doing your other things? Most people know. I worked the rest of the day. I did some other things, used my arm just like any other time. Some people will have a little bit of swelling in that area. Some people might have a little bit of itching. The key thing with this is the short term. It doesn't last very long at all. The more lasting side effects can be that headache, can be that you feel a little bit tired, can be some people will have a low-grade fever. Those are not surprising. It is the body reacting to saying, uh-oh, something I don't recognize. And you actually want to be able to say, okay, something's going on, because the next time it notices that there's real COVID-19, not a vaccine that doesn't have any COVID in it. So if that virus, the SARS-CoV-2, when your body notices that, it's got that, and you won't notice at all. You won't even feel it. You might have been around it. You might have been exposed to it. Your body already knows, takes care of it, and you don't even know. Just like with other diseases that you're immunized against. You may be around them, but you'll never know because your body knows how to fight them off.
Awesome. So I was thinking a little when you talked about the way it feels going in, even though we're seniors, a lot of us still turn into babies when it comes to shots and we run from the table, just the thought of it. So thank you for clarifying the actual effect, of the shot once it's going into your arm. So some other questions that people have had interest in is allergies. So one patron has asked, I have severe allergies and I'm worried about a potentially serious reaction, such as hives around the lips, eyes, throat impacted. Latex gloves will also set off my allergy. Are the mass vaccination spots an option for me, or should I wait for my doctor to administer my doses to be sure special assistance is readily available?
Sure. So I will tell you, at the mass vaccination clinic sites, we do have EMS on board. The last thing you want is to have EMS there, but we have EMS on board. As you know, we have EMS in our department. So of course they're going to support us at all of our sites, and they are there. We also have medical staff that is doing all of the observations. However, one of the precautions is people that have severe allergies, meaning they've had an anaphylactic or a throat closing event. Those others who have the allergies that this patron has described, we recommend that they talk to their physician first. Some of them might want to just come with make sure they have their EpiPen when they come, or make sure that they have some other pre-dosing with some other medication or Benadryl or something like that. But we would recommend that they would talk to their healthcare provider first if they have severe allergies. Okay, that's important. That's really important. I will let everybody else know that that doesn't have those allergies. We don't use latex gloves, because latex is one of those common. Sometimes it's an allergic response, but sometimes it's just an irritant. And when we have people that are putting on gloves over and over during the day, we cannot, for them or for the public, we just cannot have the latex gloves because they can be irritating. So, put your mind to rest as far as latex gloves.
Right. Okay, so I'm looking at some of these questions and you've already answered some of them, so I'm going to go ahead and just breeze over them. But one person wants to know, if a person takes the COVID-19 vaccine, say within the first 2-week period or so, will and they refer to it as jab, cause the individual to test positive or a false positive?
Very, very common, very common. So the tests that are administered are only for the actual virus, and we're not putting virus in your body. So it will not turn the test positive. That's a very common question, and it's understandable.
Awesome. So the next one is pretty specific. It says, are the first and second doses of the Pfizer vaccine the same, or do they have different properties?
They are the same. They are absolutely the same. So the first one lets your body know what's going on, but the second one is the same one, and it will boost your immunity.
Okay, so this next person obviously suffers from their blood sugar being unstable, and their question is, if your blood sugar is not stable, will the shot affect your health?
So COVID will affect your health if you have blood sugars that are not in good control. It's
Right.
one of the highest risk factors for doing very, very poorly with the disease. So one of the things that you would want to do is protect yourself with the vaccine. The virus takes advantage of those whose immune systems are not as hardy and able to fight. And we know when we don't have a good control over our blood sugar, our immune systems are not as strong. So this vaccine is ideal for those type of people. For you, whoever the caller is or who had that question, it's ideal. Definitely, if you have concerns, confirm that with your healthcare provider. I always tell people to do that because that's the person you have a relationship with and who you trust. So you want to make sure you do that, but it's ideal for people at risk, especially with poor glucose control.
Exactly. So if you have any underlying condition, you need to make sure that you seek information from your physician. And this question is pretty interesting. It says, if someone in your family gets the shot, is there a chance they can get the virus from the vaccine? And I think you've already answered that because you said the vaccine does not contain the virus. So do you want to expand just a little bit more on that?
Sure. And I understand the question is, well, I think it may come, we've got some very savvy people. So I think it may come from vaccines in the past that had live virus in them. And so like the oral polio, they tell you, please don't be around somebody at high risk because you might shed. Well, this doesn't have any virus in it. The new vaccines that are going to come out will also not have any live virus in it. But it's a great question because you don't want to be around someone that's had a vaccine with a live virus. But this one does not have it. So there's no way that you can share it.
Okay, and I think you've already answered this last question under efficacy. And this person wants to know if they have a poultry allergy, should they take it? And that one was pretty specific. So I think we should go ahead and address it.
I think that may come from, in the past, we've had some egg vectors for our vaccine. That's how you replicate a vaccine with a virus in it. So the Pfizer and Moderna vaccines do not have, that's not how they're made. So eggs, that takes that out of the equation. However, depending on their response to poultry, they want to discuss with their physician or their healthcare provider. If they have a terrible response, that talks more about their immune system. And so they would just want to ask. But again, there's no egg involved in the Pfizer and Moderna. So that's a great question. But since that's not involved, that wouldn't preclude them from having this, this vaccine or these two new vaccines.
Okay, so we finished up that first section. Let's move on to the location of the vaccine. Can the vaccine be taken in Harris County if you reside in Fort Bend County?
Absolutely, absolutely. It actually, just so everybody knows, It can be taken anywhere. Now, we don't want you traveling. With the amount of disease in this country, we do not want you traveling.
Absolutely.
Okay, so just stay put, stay
Absolutely.
home, stay safe. However, just so you do know that wherever in the country you were to go, if you were to go somewhere, 3 weeks out, you could still get your next dose in another part of the country. It's the same too. It's national. This is all coming from the federal government. So absolutely. If you need to go to Harris County, if for whatever reason, when it comes to Waller County or Wharton County, Brazoria, wherever you can get the vaccine, please avail yourself of it.
And that's pretty good because that lets people know that they have several places that they can go to. If they get uncomfortable waiting for it in their county, they may have relatives that live in Waller County and they may want to go and pay a visit to them and get on their list. So that's good information. Is there a hotline number in Fort Bend County for the vaccine?
There is. I'm going to have to make sure that I don't give it to you wrong. And I'm going to look it up right now. But oh, good. She has it. Yay. Oh, she has it. So it is 832-471-1373. That's the vaccine hotline. If you have other questions about anything else, you can certainly call the helpline. But the vaccine hotline, as you put up, 832-471-1373.
And we'll put it up again at the end. But we have just a few questions in this category, but this one is pretty interesting. And I think everybody's ready for this one. I'm interested in knowing how to register for the vaccine.
Yes. Well, good. So those of you who are computer savvy can do the online pre-registration. So when we had our first shipment of vaccine, we got 1,000 doses at that time, and we opened up for registration. And before the day was out, we had over 5,000 applicants.
Wow.
Well over 5,000.
Wow.
So we were able to vaccinate those 1,000 plus a little bit more because we got 2 smaller shipments. But those people who've been waiting since that first shipment came through, they will be first scheduled. However, when we open up for registration, you can get your name on then. So when the next shipment comes, then you'll be first up to get your vaccine.
Awesome. Okay, moving forward, how will we be notified when it is our turn to get vaccinated?
Right. So as long as you've registered and you're in that pre-registration queue, all of the people who are pre-registered will receive a call, and they will be walked through a process that, with a clinical person, just to make sure everything's okay, and then they'll get their appointment. In the future, we also hope to do the same thing with scheduling once there's enough vaccine out. Right now, because the vaccine delivery is uncertain, it's difficult for us to have people schedule and the vaccine might not be here. So right now we're doing it. We will call and we will schedule those appointments. So if you're on the list, make sure you answer your phone so that you can get your appointment.
And that's important that you answer the phone. You know the numbers. You should be expecting a call back from those numbers if you're not connected with someone on your initial try. And is there a way for residents without computer access to register for the vaccine?
Absolutely. So those who do not have computer access can be assisted by the call center. And that call center is 281, she's got it, 633-7795. 281-633-7795.
Okay, let's move on to the next area, misconceptions. There's so many myths going on, so many untruths that are floating around. And so we want our seniors to have exact information. We want them to be knowledgeable about everything that's going on. So someone had a pretty interesting question, and I thought it was amusing. They said the only concern that they have is overhearing that the makeup of the vaccine has the effect of changing the recipient's DNA. And my response to that was, don't mess with my DNA.
Oh, that's a great response. That's a great response. And it is a little bit confusing when it's a new technology. So the vaccine that's been around for a while, when it's only going to go into your muscle. It cannot change your DNA, but they've been hearing certain terms, and so there's a lot of misinformation out there.
Okay, so let's move on over to the next area, which is vaccine availability and type. When will the vaccine, this is the big question, when will the vaccine be available to me and to others here in Fort Bend County?
Right. So right now, the vaccine, we've just gotten our next shipment. We just announced on the news. I'm sure some people already heard we got our next shipment. We'll be operating as a hub. And so that vaccine is going to be available to those, really to those ones that were just on that list. As you register, and hopefully as we get more and more, we will have that for everybody. Right now, there's the healthcare workers and those who are over 65 or have medical conditions that put them at higher risk. There's some that are going to be listed, but there are additional medical conditions that may put you at risk. I would just check with your healthcare provider and say, hey, do you think this would be a good idea for me if you don't have one of those on the list? And most likely they're going to say yes. But if you're over 65, you can get that vaccine. All we need is your ID so that we know, what age you are. Some of you all look very young, so we cannot take your word for it. We will have to see some ID to prove to us that you are of age to receive the vaccine.
Thank you for that compliment. So I think you pretty much covered all of the questions that was in that section with that one response. I think the only one we haven't really heard definitively is how many vaccines do you expect to receive in Fort Bend County?
Right. So eventually, and this is by the end of February, beginning of March, we expect to see many. If we want to vaccinate 100 million people, I think the new president has said in 100 days, they're going to have to ship a lot to us. I can't put a number to that, but I guess I could say if we have 800,000 people in the county and we want to get to this herd immunity and we need about 70 to 80% of those people, well, that's going to be, somewhere around 600,000 people. So that's how many doses we're going to have to have. Our current allotment is over 5,000. So we'll get a lot of people in with that, but not near the number we'll need. Hold tight and be patient, and we will get that vaccine to you.
Awesome. And this next and last one for this section, I really love it. Will the vaccinations be available here at the Pinnacle?
So absolutely, we're looking at so many different locations. If it's not at the Pinnacle, we might be at the school across the street or the Boys and Girls Club in front, but we absolutely will want to be giving that vaccine out. There's no way we can do 600,000 vaccines without looking at a lot of different opportunities. We just purchased a mobile unit, so we'll be able to take that mobile clinic with us all over the county and set up sites and be able to vaccinate people.
Awesome. That's awesome. So one more question, and we're going to wrap this up. You've actually gone through these pretty rapidly, and the information is so informative. And we really do appreciate you spending time with us today and getting us up to speed on what is going on specifically here in Fort Bend County, because most of our local stations cover mostly Harris County and the city of Houston. And we're out here in Fort Bend going, hey, what about us? What's going on over here? But our very last question is, do you know when the Johnson & Johnson vaccine will be available?
Yay, just heard today. And not, of course, remember, anything can change, but we understand that they'll be submitting for approval at the end of February. That's important because we'll learn more about the safety profile safety should be good, but the efficacy profile. And that's important because you'll need to be able to make choices. A lot of people obviously would prefer one dose as opposed to two, but there will be a change of how effective it is. Okay, so we'll just want to kind of wait and see what's going on there. But yes, the end of February, we were just told on our calls today that the end of February they should be submitting for review with the FDA. So we're looking forward to that time.
And so are we. Awesome, Dr. Mentor. Thank you so much for the Pinnacle patrons joining us for this virtual town hall. Thank you, Dr. Mentor, and to your staff who's doing an amazing job working the front lines for us, for our protection. We just really want to end up with saying we appreciate you guys. We appreciate your hard work. We know that it is totally overwhelming. And for those who are not on the front line, we see the exhaustion. We see how it's having an effect on you guys. So we keep you in our prayers, we keep you in our thoughts, that we will continue to combat the virus, and that one day we will be able to, as they say in that airline commercial, we can be free to roam, because we are ready to come out of our cages. So we also want to thank your communications team, Sally and Rita, for their behind the scenes work on making this video possible. And for more information, again, we want to go ahead and give you the information that was covered earlier on any information you want for COVID-19. You can go to any of these websites. I will put the posters up for you. They'll also be available in the e-blast. So the first one you want to be able, and Dr. Minner, if you could go ahead and read those for me, because
sure,
I'm behind them.
FBChealth.org. That's FBChealth.org. And it has a lot of information on it.
And?
Okay, now I'm not sure which is this. Is that FBCHHS.org? FBCHHS.org.
Okay. And the helpline again?
And the helpline is, and that's the one that can assist you if you don't have a computer and you just have general questions. That's going to be 281-633-7795.
And our last one, the FBC COVID vaccine hotline.
Hotline, yes, 832-471-1373. And I want to thank you, Sonia, and your staff. Your staff is undergirding all of us all the time. We're a family. HHS is a family, and you're part of it. Also hosting this town hall for our very, very special residents of Fort Bend County. We appreciate it. Anytime, ask us back.
Thank you so much. And just want to let our audience know that we miss you. We want you to continue to stay safe out there. Bye now.